So hello and welcome. I want to thank everyone for joining us for our webinar today. And today we'll be discussing different strategies that you can bring right back to your organization to really improve mental health in the workplace. And we are very excited to have the CEO of Tranqool, Chakameh Shafii, join us today. So welcome, Chakameh.
Hi, Hilary. Thanks for having me.
We're very excited to have you. And I'm your host, Hilary Turk. So I really have one of the greatest jobs in the world, and it's just to positively impact people's health and quality of life. And I get to work with different organizations on implementing wellness strategies with Optimity. So we have about 200 guests joining us today, and while we are waiting for all of the guests to arrive and get settled, let's take a moment to go over some logistics. So to connect to the audio, use your computer's microphone and speakers, or select Use Telephone after joining the webinar to turn on the sound. And of course, all the guest lines are muted to avoid any background noise. And if you have any questions, please type them in the tool at the bottom, and we will answer them during the Q&A period. And the slides and webinar recording will be sent out to you to share with others after this presentation. And in the handout section, there is a Willis Wellness Report, Optimity case studies, and as a bonus, there are downloadable mental health posters that you can post around your workplace. Okay, let's get started. So Optimity is a digital wellness platform that helps employees to be successful at work through something that we call micro-habit training. So with our clients, we've helped improve their quality of life at work, and Optimity is used by organizational leaders to understand the pain points of their employees' health. So for any organization, we strategically target your highest cost health issues to really achieve a quantifiable ROI. So we have proven results with all of our clients, and I have worked with numerous organizations in implementing targeted wellness programs that reduce their drug claims, absenteeism, and disability leave. So with our clients, we were able to help them achieve an ROI of between $1.80 to $6.93 back for every dollar that they spent on wellness. And this was a really great achievement, as the industry average is only $1.50. So our customers were able to run more initiatives faster and easier, and to really coordinate between multiple sites. So our cohesive wellness portal provides you with a database to drive your decisions on how to adapt your programs to get better outcomes. So as you can see, some of our clients include PwC, Ontario Centres of Excellence, and CST consultants. And with all of them, we were really able to increase their participation, and with PwC, we increased their engagement by 7 times the amount from the previous year. And this really had a great impact on their culture and just made it better for the workplace. With our other organizations, we were able to help save lots of hours and resources, and at Ontario Centres of Excellence, we saved 200 hours for their HR team in 2016. And most importantly, we were able to quantify drug claims like we did for CST consultants, which is why we were able to provide them with a hard ROI. And one of the most popular initiatives that we implement are associated to stress leave and antidepressants, which is why we are doubling down on mental health education and partnering with Tranqool. So today we have a very dynamic and info-packed hour, and we will give you the strategies that you can bring right back to your organization. So here's a quick agenda so you know exactly what to expect. So shortly, I'll be introducing Chakameh, and she will be sharing her firsthand experiences with mental health in the workplace. And then she'll go into describing what is mental health and really what is evidence-based therapy. And she'll discuss some top mental health trends, and then she'll share all the benefits of having company-wide mental health agendas. Then she'll go through a 2017 checklist for setting up your company. Then I will share some of our digital wellness strategies, our case studies on mindfulness, and really give you 3 tips on how to get the highest participation on strategic mental health programs. And at the end, we will go into a Q&A period where we will take the questions you submit and answer them. So once again, my name is Hilary, and I'm a wellness advisor here at Optimity. My background is in human kinetics and health promotion for corporate programs. So what I do is I work with clients to really just customize their wellness programs for targeted health and really drive better outcomes. And I'm happy to introduce Chakameh Shafii, the CEO of Tranqool. So her background is in engineering, but after experiencing anxiety firsthand and getting help through cognitive behavioral therapy, she left her job as an engineer to build Tranqool. And this was so she could have others benefit from the therapy that she had. She has become a passionate mental health advocate with a focus on increasing access to mental health services for all Canadians. So I'm very happy to have her with us today and to share some of the best practices for keeping mentally healthy at work. So Chakameh, I'm ready to learn. Let's get started.
Thanks, Hilary. So I'm excited to be here today and talk to you guys a little bit about Tranqool and the things that Hilary mentioned on the agenda. So what is Tranqool? So we're an online counseling platform. We're kind of like a marketplace for licensed therapists, psychologists, and registered clinical social workers. What we allow people to do is book sessions really quickly, so within 24 hours from now, and have the sessions from the comfort of home, from the comfort of their boardrooms, or from the comfort of schools. So we kind of bring the accessibility of therapy. We make it much more affordable, and we're still insurance covered, which means people can stretch their insurance dollars if they have it from work, or if they don't, they'll be able to afford it because, as we all know, mental health counseling is actually not covered by our public healthcare insurance. So let's get into it. So why is it important for us to talk about mental health? I'm going to go over these numbers. I'm going to talk about the mathematics of why we should be caring about mental health, but then afterwards I'm going to talk about something much more important, which is empathy and resilience. So, you know, just in Canada alone, there was a 50 billion hit a year to our economy because of mental health. 20 billion of that is specifically to workplaces, which means these are things like short-term disability, long-term disability leaves, as you can see in the slides. There's 30% of them are due to mental health. And interestingly enough, depression and stress are the top 2 causes of those leaves, and depression is the fastest growing reason for leaving workplace, whether it's short-term or long-term. So if you think about fastest growing, not just in mental health, but in all sorts of illnesses. So people aren't really comfortable talking about mental health. The stigma exists. I know there's a lot of organizations that are doing so much work to breaking down the stigma, but it still exists, and 23% of the work field doesn't feel comfortable talking about mental health. I would even go as far as saying that number's a lot higher in reality, but that's just the stats that we have. So where does the role HR in companies that are large enough to have human resources, the role they play is so important and so strategic that they would be able to drive not only financial and legal stability for the organization, but also just an overall success rate for any company. So all right, so let me start off by talking about mental health, because what is mental health? Mental health is 100% not mental illness, because when we talk about mental health, the first thing we all think about is mental illness. It is not. Mental health is something that we all have. It's like physical health, except for your body, for your mind, so your emotions. And 100% of the people have mental health. Hopefully, most of us have a healthy mental health. But in a lot of cases, mental health is something that is very impacted by the environment that we work in, and needs to be taken care of. The reason I'm extremely passionate about cognitive behavioral therapy, CBT, as you see on the slides, and in general evidence-based therapy, is that it works in a way that is short-term, result-driven, and the outcomes are measurable. It allows organizations to be able to really estimate how long it's going to take for someone to come back to work, and also allow people to have confidence that they'll be able to really manage their negative thoughts and emotions and build the resilience they need to be able to lead really happy and healthy lives. So, as many of you have probably heard or have read, there's 3 things that I think most of us won't be able to get through our days going through Facebook and not seeing at least one of them. Meditation, mindfulness, and some of us might have heard CBT as well. So these are terminologies that a lot of us think, well, you know what, this is what's trending right now, and it's not important. I'm not like, what does that even mean? Like, meditation might not be for me. What does mindfulness mean? Is that what, you know, like the monks do? Or, you know, it's a terminology that we're not really clear on what it is, but we've all heard it. So I'm going to talk about those 3 things, and then I'm going to talk about how those 3 things can be delivered and how they are currently being delivered and the trends that we're seeing. So meditation is not for everyone, but it's the act of taking a step back from our day-to-day life, setting aside a certain amount of minutes or hours a day to just sit still and clear our minds by being able to stay focused in the moment, which is where mindfulness comes in. Meditation is a very useful tool. There's a lot of applications out there that have made it easily accessible for a lot of people. Mindfulness is a little bit more complicated than that. It's there are nuances to mindfulness because it's about learning how living in the present can impact our mental health and our overall happiness and mood. CBT, as I mentioned, is cognitive behavioral therapy. It's all about the relationship between 3 parts of us: our emotions, our thoughts, and our behavior. Our emotions, our thoughts, and our behavior, and how by changing one of those 3 things, the other 2 elements are actually impacted. So how are these 3 things being implemented in 2017? First of all, as you would have guessed, mobile-first strategies, which means all of us now expect things to be delivered to us on our mobile devices. So whether it's meditation app, mindfulness tools, or cognitive behavioral therapy, we expect it to be delivered on mobile devices. Adaptive solutions means designed around your personalized character. Holistic health is where I think there's a lot of holistic health incentivized self-care, is I think what Optimity is also trying to do, which is, you know, it's more than just me focusing on my mental health and waiting when it's too late. What am I to think about my well-being as a human being? I have different aspects to me. There's physical health and emotional health, and I need to be making sure that I take care of every single aspect of me. And then finally, outcome-driven results, which is measuring ROI. So I can go on and on talking about the financial benefits, the legal benefits, and the employee engagement benefits of implementing a mental health agenda across your company. And I don't want to be repeating so many things that you've probably heard, stats that I just mentioned, and things that you can probably read online. What I really want to talk about is 3 super important factors when it comes to rolling out a company-wide mental health agenda, and the benefits, and how you can take this and get the support you need from C-level execs to roll out these programs, okay? So it starts off with the impact on company culture. So having a healthier place, whether it be changing the physical environment where employees are working, whether it be inputting programs where you can measure the impact with exactly programs like Optimity, whether it be actually having an acceptance to stress leave, a mental health day, because a lot of times sick days are for physical sickness, but a company culture that accepts mental health days in their sick days is very important. Measuring overall outcomes. And what I mean by that is that having a mental health first company means that the overall outcomes, the results, the productivity that the employees have are significantly impacted, as you saw by the results of many of the case studies that Hilary initially presented to you guys. And then finally, the most important point that I would like to make is about employee resilience. We always say that, you know, we are always as strong as our weakest link. And in a company, in a team, we are all just as strong as our weakest link. And if there's one person, one employee that is not resilient enough to bounce back from a failure, then the whole team fails. And I think that's one of the most important driving factors when it comes to opening up the conversation about the importance of mental health first styles of companies. And then in terms of how you take that and you go into speaking with your C-level execs, actually in the next slide we'll be talking about a checklist. So actually I think it would be important for you to look through some of the past experiences, past employees who've had mental health issues, and how that incident or that event impacted the company as a whole. Understanding the top best practices. So this includes just looking through some existing research, looking through organizations or vendors. I think we explained that here. Yeah, vendors who also help with that. Understanding like what are some of the things that we can do in 2017, and really setting aside some time to think about this, because you know when it comes to budgeting season, which we usually do at the end of the year, we budget for different things, activities that we're doing to help the company grow and become better in terms of productivity and ROI. We also need to set aside a time and budget to think about what are some of the initiatives that we're going to run for mental health specifically, how much are we going to spend, and what are the resources we're going to allocate. And I think that's super important. And when going to your executives to talk about that, you should always be taking some of the past experiences with you, some of the things you can do, and also get some organizations who can help you with that, including Optimity or Tranqool. Yeah, so with that said, I'm going to go through a case study. So as many big organizations know, startups don't really have HRs. Startups don't have as much support as larger companies do. But I want to go through an interesting example of what Tranqool has been able to do with a couple of startups and how maybe larger organizations can learn from them. So startups in many cases don't have a benefits plan. They don't have insurance, which means they might not be able to afford therapy, because then they'll be choosing between getting glasses and doing therapy, and sometimes that falls behind because we give importance to our physical health. So a couple of companies worked with Tranqool to provide all of their employees, which is usually less than 50 of them, access to Tranqool, and Tranqool would then make it free for all of them, and then we would get invoiced back the company. And what they saw was comparable to EAP systems in larger organizations. People were using Tranqool because they wanted to speak with therapists, and people were using them without having to lose hours working or leaving their work. What does that mean? If I want to see a therapist, I have to work from 9 to 5, and I have to find a therapist who's going to work outside of 9 to 5, which is almost impossible, or on weekends. But with Tranqool, they were able to speak with people, life coaches, stress therapists, all psychologists, and they would be able to see them in a meeting room at their office during the day, or after hours at 9 p.m. or during the weekend. So it was an opportunity for startups to provide that support to their employees that they before weren't able to do because they didn't have EAPs. Anyways, with that said, I'm going to give it back to Hilary. Thank you so much.
Well, thank you. And thanks so much just for sharing your expert advice and just all of your personal experiences with mental health in the workplace. So now what I'm going to do is just give you a quick background about Optimity. So at Optimity, we really work to support you with a gamified and fun solution for your workplace wellness. So we work with Fortune 100 companies to create good practices to improve employees' health quality life at work, and also to drive down risk for health conditions. So when I work with clients, I do see the classic problems in modern employee success practices for the wellness managers. First, there is now more multiple demands, and this is coming from leadership and employees. So there's lots of great ideas, however, they're finding it really hard to prioritize them. And again, I'm seeing that it's very hard to coordinate, so there's now more of a dispersed workforce, people are working more flex shifts from home, and lots of organizations are having a bimodal distribution. So they're having millennials and baby boomers, and they all have very different preferences. And you need to be able to make sure to serve these different needs for their workplace wellness so they get the most out of it. And there are new requirements, such as a need to provide mental health initiatives and financial wellness education. And I'm sure, as you're aware, there's a very high employee to HR ratio, and that just means you're tasked to do a lot more with a lot less. And finally, demands are becoming much more metrics driven, and you're using more spreadsheets, you're sending out more emails, where really you need a centralized dashboard and automatic smart analytics. So that's what we help with here at Optimity. We make your life easier and keep your people healthier. So when we look at a much larger organization such as PwC, they have a very fast pace and mentally demanding jobs. And then, so by using some of the practices we use here at Optimity, we're able to help with some of their core HR issues such as sick leave, turnover, and workplace stress. So we launched with their audit team during their busy audit season, and they were really busy working on things for their clients. And we were able to provide them with a buffet of content to really help reduce the negative side effects of this demanding job. So we really worked on their culture and having them connect more as a team. So for example, we did things like team lunches, mindfulness activities, and healthy competition between each other. So we found that this really helped to improve their culture, improve the participation rate, and we were able to help increase their engagement by 7%. And then this led to a decrease in drug costs, such as antidepressants and sleep aids. So let's look at another use case with Ontario's Centres of Excellence, which has a very dispersed workforce over multiple locations, and they only had 2 HR professionals. They had a lot of great initiatives, but were spending a lot of time and resources organizing it for all of their employees, because each employee wants and needs different things related to their workplace wellness. So when Optimity was implemented, we were able to centralize all of their initiatives into one dashboard and send out personalized content to all of their employees. We were able to centralize their event announcements, send out mobile notifications, and automate email templates. So we found that this really helped to boost all of their attendance for their workplace wellness initiatives. And so everything was pre-scheduled, and they were going from spending 5 hours a week to only 15 minutes. So it really helped to cut a lot of the noise, and they were able to focus on the programs that the employees really found useful and really wanted in their organization. So one of our own mental health initiatives that we do here at Optimity is used at our regular wellness advisor team meetings. So at the beginning, everyone gets 2 minutes of uninterrupted time, and that's just to say whatever is on their mind. So I find it's just a really great way for all of us to connect, and it really makes our relationship stronger, and we get to connect on a more personal level as colleagues. And really, this only takes 10 minutes to do, and it's just a very fun and easy thing to do with all of your colleagues. So here's just some more quantifiable results with some of our partners. We were able to dramatically decrease the rates of absenteeism and sick leave, And we were also able to really increase the engagement in the organizations, and this really led to a better outcome. So, as we all know, employee health costs are on the rise and increasing in drug benefits, absenteeism, sick leave, and turnover. And the trend in North America is that these health costs are rising 10 to 20% year over year. And another shocking statistic is that 70% of North Americans are on at least one prescription drug. And this is due to preventable health issues such as insomnia, stress, and back pain. And it's becoming a huge cost to companies as they are losing over $1 trillion to these preventable health issues. So, like I said, the increase in these drug and health claims are continuing to increase year over year, and every day you don't implement a wellness strategy is another day you're losing dollars to these increases. And the reality is that traditional wellness programs don't provide a hard ROI by reducing or controlling these health claims. They tend to focus on things more as participation, rewards, and recognition, all of which are great, and we encompass those as well. However, they truly fail to dig below the iceberg and impact these metrics. And these are the ones that are costing you dollars. So at Optimity, we make a digital wellness platform that works through wearables and mobile apps to help you integrate healthy micro activities into your everyday routines. So it can be as simple as doing a backstretch or a mindful minute in between your client meetings. And you get points for doing the activities, which you can claim for rewards, such as a $20 Starbucks gift card, which is my personal favorite. And of course, I would only buy healthy things at Starbucks. And you get to track all of your progress on one leaderboard. So we also help your company reduce their business costs, and this is just a snapshot of our admin panel, and this is really where the power of the program lays. So this is where we will present all of your employees' health behaviors to you on an aggregate level. So for mental health, we are able to show you insights into how many employees are at risk for falling into the depression category. And those employees are then sent content at the right time to help reduce this risk. So let me recap how the Optimity platform works and all of the components to our fully integrated ecosystem. So it has a customized mobile app that is available in 3 languages and accessible on any mobile device. And it connects to over 250 wearables and apps, and we can provide those wearables to you as well. And the centralized dashboard allows you to see real-time data and easily implement your holistic wellness practices. And we also have advanced analytics that helps to retarget your highest health cost issues. So traditional wellness programs such as yoga classes and gym reimbursements tend to be adopted by the super fit. And on the other side, the disease management programs such as on-site nurses and EAP programs are being used by the already sick. So only Optimity focuses on the middle majority, and this is where most of the current drug costs and absenteeism are coming from. Oops. And we also help to contain these future costs. So Optimity was able to help many organizations in 2016, and that was just by engaging their middle majority. And we were able to achieve an industry-high average participation rate of 77% with all of our clients. So now I'm going to share some tips and practices with you on how to help our clients increase their mental health initiatives in the workplace. So my first tip is to go grassroots, and you can really practice this with or without technology. So you want to recruit champions for mental health initiatives across your organization. You want to build a leadership culture within the staff, and by having an in-person touch really helps to push the mental content forward and just makes it much more effective. And you really want to decentralize the effort, but centralize coordination and results. So this can help save you lots of hours and admin work and just makes things much easier for yourself. So my second tip is to go mobile. So everyone has a smartphone these days, and people are continually working from home, so they have more flex hours and they're always on the go. So by implementing a bring your own device model, you'll be able to help your employees get the right information at the right time. And since mental health is more personal, this is more of a self-serve buffet where you can choose your own content. And wellness emails are a thing of the past, and they rarely get checked or dealt with. We find going mobile works much better than a newsletter. We find that most people are 15 times more likely to engage when it's delivered right to them, and it's just more personal in that way. And lastly, my third tip is to go data-driven. So in order for any goal to be achieved, it needs to be measurable. So get those metrics, get the expert support, and improve and customize your offerings over time. So you are doing so much every day to drive the success of your organization. So it only makes complete sense to take a strategic view on wellness as well. So set those KPIs and consult with the advisors like Chakameh or myself, because we are very happy to help. So Chakameh, how about we do a quick recap for our guests?
Of course, yeah. So in terms of mental health takeaways, as I mentioned, think about those three elements that I mentioned: company culture, building employee resilience, and also going result-driven. Going towards speaking with your C-level execs with result-driven styles, which means making sure they understand that when you're asking for a budget to roll out a program, that you have a backlog of experiences with mental health that you can take with you. It's really interesting when you can draw on empathy to make decisions, and having an experience would be an experience of an employee or staff member would be very, very helpful to drive that decision-making process.
Mm-hmm. And then I shared how a digital platform like Optimity can really support mental health in the workplace. I talked about digital solutions and some of our best practices, and I shared 3 tips on how to get the highest participation in your strategic mental health programs. And then I also talked about how holistic health can really be scalable and engaging. So for anyone located in Ontario and are looking to learn more about Tranqool, please email Leslie Wise. So her email is leslie@tranqool.com. And if anyone wants to learn more about how to improve mental health in your workplace or implement a wellness strategy, please reach out to me at hturk@myoptimity.com. And we have our next webinar, which is next Thursday, April 6th at 2 o'clock Eastern Time. And it's going to be all about employee engagement best practices. So you can register for our webinar on our website at the link below. So I want to thank everyone for joining us today, and I really hope you have a great day, and don't be afraid to reach out for us if you have any questions. Have a good day, everyone.